Dr. Orman, and I have been treating Susan for many years. And I've helped her as well as many other people with problems with their upper back and arms and neck by adjusting their ribs. So I want to explain exactly what I'm doing because it's been helpful to Susan and she would love to have this done again in DC for her. So when I adjust the ribs, I'm keeping in mind that these ribs sometimes are popping out like this. And so when I go along the rib cage, you know, I may feel a rib sticking out, and oftentimes it feels to me something like, you know, going along the white keys of a piano, and all of a sudden I feel a black key. So when I'm adjusting it, and usually there's a lot of muscle tension around it, let's say it's popped out like this, I'm adjusting with, this is my electric powered activator, but this can be done with a regular activator as well. I'm pushing on the rib and clicking along the rib. Oftentimes with Susan, she has these first 3 ribs out, so I'm going along here. And for this first rib, oftentimes the trapezius muscle is there. I'm having to go around the trapezius, and this one often will subluxate superior, so I'm going in like this. And I'll show you on her as well, but this is basically so you can see on the skeleton. Then, so again, from the back, I'm going in an inferior to superior direction and lateral to medial. Then I'll have her sit up and lift her arm up, and I'll get way up under here. Now, and feel the side of her rib cage, and also those will stick out and they get super sore. If the patient lifts their arm up like this, the musculature gets in the way and you can't feel the rib anymore. So what I'm going to do is just have them let their arm hang, and then I go up under here and feel the side of their rib cage. And in this case, I'm sticking my activator up in there. It's very tight and not particularly easy to get in, and very uncomfortable for the patient, just so you know, it kind of hurts. And I'm putting my activator right on the rib and clicking this way. Sometimes I have to get way, way, way up in here even. Then, now I don't do this on every adjustment. I start with the back. If that's enough to, you know, get the rib back in place, I stay with that. If it still feels like it's out, or the patient tells me it still feels like it's out, then I additionally do the axillary side. But sometimes they even have chest pain. And I'll go here along the anterior aspect of the rib where where it meets with the sternum. And like with a woman, I'll have them move their breast out of the way, so there's no way I'm going to use the activator on their breast tissue, because I don't think that's a good idea. We want to get as close to the rib as possible. And I'll get in there, and it's almost a anterior to posterior, A to P, with a little bit of inferior to superior motion of the activator. And I'll go along
and
there.
And is that the one, because the other one you used to put your fingers down and do it? You don't have to do that with the electronic?
It's the same thing.
Okay.
Oh, so I put you're talking about
and then you would do it
on your finger,
yeah.
because it gets so sore.
Yeah.
So sometimes any of these, if they're very sore on the patient, I sometimes will put my finger down and do it on my finger, which doesn't hurt my finger at all, by the way. I'll use my thumb sometimes. But lately I've been just beating them up and going directly on the rib. And nobody complains too much. So, but if you want to, you could put it over your thumb. It makes it a little more comfortable. Sometimes you want to do that clavicle as part of it as well. And most often I find the clavicle subluxates superior, and you can feel like a little edge of this clavicle here. And if you try to get behind the clavicle on the patient, and there's not much room between the trapezius muscle and the clavicle, it's because the clavicle has kind of pushed itself in somehow, and that happens a lot from rolled forward shoulders. And I just try to get my activator slightly behind it and activate from posterior to anterior, pushing the clavicle out anterior more.